On the drug-drug interaction on Nurofen and prednisone. So the welcome country, we acknowledge the Wiradjuri, Ngunnawal, Gundungurra and Biripi peoples of Australia, who are the traditional owners and custodians of the lands on which CSU's campuses are located, and pay respect to their elders past and present and those emerging future elders. We also acknowledge and pay our respects to Australian Indigenous colleagues and peers who are present. So the overview of drug-drug interactions, pharmacodynamics and pharmacokinetics. So drug-drug interactions are where one drug can either increase or decrease the effect of another drug. And then increasing the effect can be beneficial or detrimental in ways such as causing toxicity. On the other hand, decreasing the effect can cause a loss of effectiveness of the drug. So pharmacodynamics and pharmacokinetics. So pharmacodynamics is how a drug affects the body and is impacted by pharmacokinetics. Whereas pharmacokinetics is how the body affects the drug by absorbing, transporting, metabolizing, and excreting the drug. So on the health condition and the impact on the comorbidities for type 1 diabetes impacting coronary artery disease. So type 1 diabetes has a strong correlation towards developing coronary artery disease and people experiencing worse outcomes if they have both diseases. Diabetes can cause insulin resistance, which can lead to arthrogenesis, thus increasing the risk of coronary artery disease. Studies have shown that patients with type 1 diabetes are not only more likely to develop coronary artery disease, but also have a more severe case of it than those without type 1 diabetes. Hypoglycemia is associated with type 1 diabetes, and it has been found to be a potential cause of coronary artery disease. It has also been found that type 1 diabetes speeds up the rate of developing coronary artery disease, but not the age at which type 1 diabetes was developed. Another study found that diabetic complications such as dyslipidemia, systolic hypertension, and renal deficiencies, as well as microvascular complications such as retinopathy, have a correlation between coronary artery disease and death. So for people with type 1 diabetes, coronary artery disease is the main cause of death and morbidity. And then women with diabetes are also more affected by coronary artery disease than men. So expanding on the summary between the interaction of Nurofen and prednisone. So the normal pharmacodynamics, pharmacokinetics, and unwanted effects of Nurofen and prednisone vary. So the pharmacodynamics of Nurofen involves blocking prostaglandin and the COX enzyme production, which allows the anti-inflammatory nature of the drug to work and have an analgesic effect. Nurofen is absorbed well by the GI tract. It is then bound by plasma proteins to be distributed, where Nurofen is then metabolized in the liver by glucocorridation, followed by excretion from the kidneys through urine. So some common unwanted effects of taking Nurofen involves nausea, gastric ulcers, diarrhea, and hypertension. So for prednisone, the pharmacodynamics consists of modifying the body's gene expression, which then promotes glucocorticoid and mineral corticoid effects such as immune responses, suppressing inflammation and water retention. Prednisone does this by blocking the production of leukotrienes, prostaglandins, and thromboxanes. The GI tract rapidly absorbs prednisone and is activated by hydroxysteroid dehydrogenase. So prednisone binds to the albumin and transcortin to be distributed, and then hepatic metabolism removes prednisone from the body. Pre-glycoproteins enhance the excretion process of prednisone. The more common unwanted effects of taking prednisone involves infection, hypertension, and hypoglycemia. So the interaction that affects one or both drugs, pharmacodynamics and or pharmacokinetics, is that the drug-drug interaction between Nurofen and prednisone primarily affects both drugs' pharmacodynamics. The interaction between prednisone and Nurofen heightens the effect of the drugs on the GI tract. Thus, a lower dose of both drugs is recommended if both drugs are being taken to reduce the risk of gastric ulcers. Studies have shown that prednisone by itself increases the risk of gastric ulcers, and then if you combine it with Nurofen, the risk approximately doubles and the possibility of GI toxicity increases. So bleeding and holes in the intestines and stomach can also occur as prednisone irritates the GI tract and Nurofen minimizes the mucus produced as well as weakening the lining of the stomach. The combination of prednisone and Nurofen also affects coagulation as clotting abilities are reduced by reducing inflammation, thus bleeding can occur. So, what are the drugs prescribed for and what elements are they treating? So, Nurofen is an anti inflammatory analgesic drug treating rheumatoid arthritis and the hip arthroplasty. So, the elements of rheumatoid arthritis that Nurofen is treating for symptomatic control are inflammation and mild pain through blocking prostaglandin production. In relation to the hip arthroplasty, Nurofen is treating post operative acute pain and inflammation. What prednisone is prescribed for is, prednisone is a corticosteroid that is an anti-inflammatory that treats rheumatoid arthritis and the hip arthroplasty. Prednisone is used for rheumatoid arthritis by reducing chronic pain and inflammation. Studies have shown that prednisone reduces joint erosion and disease activity. Another study demonstrated that the overall severity of rheumatoid arthritis can be reduced with the use of prednisone. Prednisone, when consumed for the hip arthroplasty, reduces overall pain and nausea post-surgery. So is ChatGPT correct in its summary? Whilst ChatGPT's response does not directly indicate what type of drug-drug interaction is occurring, the research gathered aligns with the response given. So the Nurofen and prednisone interaction is a direct pharmacodynamic interaction as both drugs have a negative effect on the GI tract. More specifically, the interaction between the two drugs is not agonistic as neither drug increases the effect of the other, and the interaction is not antagonistic as one drug does not decrease the effect of one drug. Instead, the interaction is a synergistic drug-drug interaction as the effect of the drugs combined is larger when combined to when the drugs are administered individually. So the impact and significance of the drug-drug interaction on the patient. Well, positively, the interaction enhances the anti-inflammatory and pain-reducing effect for rheumatoid arthritis and hip arthroplasty. However, there are potential severe negative impacts. When taking Nurofen individually and prednisone, there can already be some GI tract irritation. When you add in the synergistic drug-drug interaction between Nurofen and prednisone, the client can be impacted by increased risk of GI tract irritation, which can likely turn into gastric ulcers as seen on the client's list of comorbidities. A GI tract toxicity can also occur, which includes mucositis, diarrhea, and constipation. As mentioned previously, the impact on the body can worsen by causing bleeding and holes in the GI tract due to irritation on the stomach wall from a weakened lining from the reduced mucus production. The interaction of the drugs on the patient is evidently significant, and the pain and discomfort that can be caused from GI tract irritation is substantial. What impacts would be important to know as an allied health professional? So impacts that would be important to know in the future would be both the positive and negative. Positively, the impacts would relate to how a synergistic interaction of drugs could benefit the body and what doses of drugs will achieve this. Negatively, the impacts would be on how synergistic reactions of drugs could cause further issues in the body, such as the prednisone and Nurofen reaction on the GI tract. So that's all there is, and just some referencing. Thank you.